I'm pleased to welcome you to this event on using Malawi's community-based childcare centers to implement an agriculture and nutrition intervention. This is jointly organized by IFPRI and University of Washington's led project on strengthening economic evaluation for multi-sectoral strategies for nutrition, or SEAMS. It's a little easier. So this policy seminar focuses on research undertaken in Malawi by IFPRI, the University of Washington, University of Malawi, and Save the Children. And this was in support of the government's early childhood development program. So I want to thank those of you who are here today in the room and those of you who are joining online for a live stream. And we also have people who will be watching this as a recorded event later. So welcome, everyone. I was given the pleasure of just a brief opening remark. So this research is of great interest to me because it adds to our growing body of evidence that IFPRI's been generating in several projects on the important role of community interventions like childcare centers, farmer groups, and self-help groups as a platform for information around improving outcomes in agriculture, nutrition, and health. So these institutions have some unique advantages because they can draw on community ties to strengthen the effective delivery of the information across these sectors. We're particularly interested in seeing today how childcare centers perform in this role, given their importance as a bridge for child nutrition and health from the 1,000 days period into primary school. So we're looking forward to that. We have an exciting program for you today. Before we begin, I'd like to actually introduce our panelists. We have 4 panelists, 2 discussants, and closing remarks. So our panelists include, in order, Aisha Twalibu. She's an IFPRI consultant and formerly with Save the Children. Aulo Gelli, sorry, Aulo. That was, Aulo is my neighbor, and apparently I'm just learning his name. He's a research fellow in the Poverty, Health, and Nutrition Division at IFPRI. Amy Margolies is a research consultant at IFPRI and former IFPRI staff. Welcome back, Amy. Mary Delamonte is Senior Program Officer at Results for Development, R4D. Those are our 4 panelists. After that, we have 2 discussants. Julie Ruel Bergeron is a nutrition specialist in the Human Development Network, their Health and Nutrition Population Unit at the World Bank. And Natalie Roschnik is a Senior Nutrition Advisor at Save the Children. After the panel presentation and discussants, we'll have about a half an hour for Q&A and discussion, and then Harold Alderman will have closing remarks. Harold's a Senior Research Fellow also in the Poverty, Health, and Nutrition Division at IFPRI. So without further ado, Aisha, over to you. Thanks.
Thank you, Dan. Good afternoon, all. My name is Aisha, as already introduced, and I formerly worked for Save the Children on this program that we're going to be discussing. My role in Save the Children was to coordinate and manage the NEP program evaluation within the communities, and I was there from the inception to the conclusion, and this was in Zomba, Malawi. We started in 2015 and the program was concluded in 2017. And what I'm going to be doing today is to give you an overview of this program so that you have an idea of where we started before we get into the impact evaluation itself. As an introduction, the early childhood and development implementation in Malawi is guided by the Nation Policy on ECD. This policy promotes a comprehensive, integrated and holistic approach for all ECD programs and services for children under 8, their parents, as well as their caregivers. These programs and services that we're talking about, they are provided through what we call ECD centers, also known as community-based childcare centers, and through parenting groups. These ECD centers, or CBCCs, rural preschools that are owned and managed by parents and community members. And they're there to provide a safe, stimulating, and learning environment for these preschool children that are aged between 3 to 5 years old. Currently in Malawi, we have about 12,000 CBCCs across the country, and they're serving almost 45% of the preschool population. A key factor with these CBCCs is that they provide what we call a mid-morning meal, which essentially is a maize porridge. And this happens in the morning when the schools are in session. However, there was a study that was conducted by the World Bank that found that the main challenge with these CBCCs was a lack of food. And because of this lack of food, children are absent from school, which eventually results into CBCCs closing. And this study actually found that about 50% of the CBCCs had closed around that time. There was another study, however, that did find that even with these challenges, when you have community commitment, coupled with basic training, it can actually help communities prepare more nutritious meals for these children, their siblings, as well as this being replicated at the household level. Now, building on these research findings that I've talked about in the Experience for My Livelihoods program, Save the Children and the University of Malawi developed an intervention package that integrated ECD, nutrition, and agriculture. This intervention package involved two main aspects: trainings as well as inputs. The trainings were on best agriculture practices, feeding practices, nutritious meals, as well as diets for preschool children as well as the younger siblings. And there was also a component of village savings and loans just to help boost the communities with their economics. Now, for the inputs that were provided, the communities were given startup seeds that included biofortified orange maize, orange flesh sweet potatoes. They also got vegetables such as amaranthus and carrots, as well as legumes that included kidney beans and groundnuts, just to mention a few. It should be noted that with this intervention, there were no food transfers, and it was mainly driven by community level actors that I've touched on, the parents of these preschools as well as the CBCC actors. To conclude this session, we're going to play you a video that will give you an insight from these targeted beneficiaries, because we thought it would be best to actually hear from them as well. Thank you.
Chifukwa chakuchepa kwa chakudya chimenechi kunapezeka kuti m'makomo mwathumu anatimakanika kuwapasa chakudya choyenerera pasiku.
Improving early childhood development is the key to making sure children realize their full potential. Here in Malawi, there's a network of 10,000 community-managed preschools, but one of the main obstacles to keeping them functioning is the lack of food. Here in Malawi, there's a network of 10,000. Supported by the PATH and DFID NEEP program, Save the Children is helping communities near Zomba in southern Malawi to provide healthy food to children in preschools and at home.
We are contributing to the early childhood and development by ensuring that preschools remain open and functional throughout the year. We're actually doing this by providing support to these preschools to grow nutritious crops, by providing trainings in best agriculture practices, but also providing a diverse range of crops that they grow.
Monga bevoti moyo wa masiku ano wetu zochitika ndi zambiri. Pamene panabwera maphunziro tinaphunzira bevoti nditha kumalima pachaka kawiri, kukhala kulima nthawi ya mvula komanso kulima nthawi ya mchere.
Umbali wako nkomba phala, umbali opereka chakudya kwa Natalie, kwatipangisanira kuti ana sakukhala m'makomomo. Kwaino kuti amadzi oti ndikapita ku school ndikalandira chakudya.
The project also shows parents how to provide nutritious food at home, helping them expand the range of crops they grow and use new recipes.
Ndikho zinena kuti mbuyomo mmene analililemba sanabwere nipi anali mwana kuti anali wonyentchera kwambiri chifukwa chonena kuti sindimadziwa kasakanizidwe ka zakudya za mwana namba kusaka ndondomeko imene ija namba kuona kuti thanzi lalera lamba kusintha.
Underpinning the project is a microfinance scheme that ensures its sustainability in the long term.
Kulatwanizi timagwira ntchito limodzi posungisa ndalama ndikubwerekana ndikuti tikapangira mabizinesi kutuwa m'mabanja mwathu. Ndalama zimenezi zomwe timapeza mapofeti ku Gelli kapena azongonga banki ya muzi timathandizira ana kupereka school fund ku skulu, kugulira mauniform, makope, zolembera komanso ndikugula chokudya ikakhala nthawi ya njala.
The impact evaluation, conducted with support from the International Food Policy Research Institute and the University of Malawi, is already showing encouraging results.
It's really been amazing to actually see that the changes that the community is making.
Komano kubwera kwa nipi ndikumene kwabweretsa ngati ubale wa mmodzi chifukwa chonoti watiphunzitsa kulima kusintha kumene ndakuona kumbali ya lera kumbali ya thanzi lake komanso ndi makhalidwe a nzika zake. Ineyo ndimamva kukoma mmoyo mwanga chifukwa chonena kuti ndimadziwa nena kuti mwana wanga ngati akudya.
Great. Good afternoon. Thank you very much for joining us. So we stepped into Malawi. Now we're going to step back a little bit and I'll talk to you a little bit about the work we've been doing in the NIPI research program. And on behalf of the NIPI research team, part of us are here actually presenting. Over the next few minutes, I'm going to give you an overview of the work we've been conducting in Malawi. And this was going to focus on two aspects, the trial. So the trial itself was an impact evaluation of this ECD-based center in behavior change intervention that involved communities, trainings, and engagement around improving diet, nutrition, and development of young children. And then we're going to step back and take a look at the sustainability survey, which was geared at looking 1 year after the intervention had ended and 1 year after the trial had ended to see if any of the impacts that were found during the trial period were sustained after the trial has ended. I'm not going to show you too much data, but there's, for follow-up, there's two articles in the Journal of Nutrition that have all the numbers I'm going to talk about, and there's also policy briefs that accompany this work. In a nutshell, so as Aisha and the video showed, the idea was really to have, and thanks to Jamit and Jamie for this great particular visual, the idea was to have these CBCCs, or these ECD platforms, as a hub of a wheel. So essentially, they were really the platform where we could reach these preschoolers, but also reach their parents, and really provide a way into getting to households and the broader community to try and shift some of the behaviors related to agricultural production and diets, essentially, with a goal of trying to diversify both what was being produced and what was being eaten, particularly around a basket of nutritious foods that Aisha mentioned. This slide here summarizes the pathways where we expect sort of to see the changes, from the activities that the program is implementing to the impacts that we'd like to measure. So it's pretty complicated, but first thing to highlight is the purple sort of box, which is sort of the control activities. So the control is not pure naive control, but it's actually the standard of care that the government is providing across the country. And it's a basic set of activities around the CBCC and parenting groups, and these were found to be already effective in the PECD evaluation that World Bank funded. So we picked on that and decided to add, based on the formative work that Save the Children had done, the specific package of nutrition and agriculture activities. On the one hand, we were trying to improve the way, the quality and the regularity of the meal service that was being provided by the community, improve farming practices, and build on the sort of childcare and stimulation activities that were going on in the ECD space, with the goal of producing more nutritious crops and foods, improving the diets, not just in preschoolers, but at home as well, and then support the sort of early childhood goals of sort of preschool attendance and early learning, with the goal of improving child development, improving nutrition, and overall food security. The impact evaluation was just a cluster randomized trial, so we essentially randomized two groups of 30 CBCCs each, or 30 ECDs into two groups, one with this enhanced ECD NEEP intervention, and the control with the standard of care that the government was providing. About 1,200 households that we followed over a course of 1 year as part of the trial, and 1 year after that as part of the sustainability study, including both the preschoolers, their caregivers, and their younger siblings. So I'm now just going to give you an overview of what we found in a sort of qualitative way, and during the NEPI trial. We essentially found that marginally significant results in terms of improving parenting practices. So parents were starting to pick up improved practices, and both in terms of child stimulation, but they were not significant at the 5% level. What we found was improved preschool meals, both in terms of the quality and the frequency of the delivery. And though we didn't measure farming techniques, we saw that there were improved production diversity, improved production of these nutritious foods that were being promoted. And we saw improved diets, both in terms of the adequacy of the diet of preschoolers, the nutrient intake of preschoolers, their dietary diversity, but also the dietary diversity in the younger siblings. And that was the first sort of insight that we were getting. There was some really nice spillovers going on, and this platform idea was really reaching different beneficiaries. We also got an impact on caregiver knowledge in terms of nutritious foods and diversification of diets and things like that. But we found no changes in terms of early learning and preschool attendance. But we actually picked up an effect on linear growth in the younger siblings. Despite not seeing any changes in growth in the preschoolers themselves, the younger siblings actually grew taller than their counterparts in the control group, and we found a decrease in stunting that was about 18%, so pretty substantive. And no change in child development in preschoolers, which was all we were measuring child development during the trial period. And we found a marginally significant effect actually on the prevalence of poverty as well. So pretty remarkable in terms of all the stuff that we were seeing. And we were all really incredibly surprised. We thought it was a good idea, but not this effect. So we went back and said, okay, what's happened a year after that? So we got funding from the Gates Foundation that were really interested too, and say, okay, how many of these effects were sustained 1 year after we stopped the intervention? What we found, actually, this should be a dark green. So we found that the changes in parenting practices were actually now significant at the 5% level, and were actually across all the 4 different categories. So overall parenting practices, stimulation practices, increased positive practices for parenting, and decrease in negative practices. So getting a sense that parents were really getting bought into the whole idea, but it took a bit of time. Unfortunately, some of these effects were not sustained, so the effects on preschool meals, the control group caught up in some ways with the treatment group, so there were no significant effects there. But in terms of agriculture, we found some evidence of sustained effects of production of these nutritious foods, and also production diversity. No changes in terms of the diets, no changes in terms of the early learning. And though we didn't see growth in the younger siblings anymore, so there was sort of regression to the mean, and we'll see that a little later, we saw that the preschoolers now had picked up a significant effect in terms of their height, possibly suggesting that these older kids were responding to these improved sort of diets, but taking a little longer to respond, which is also plausible. But what we did that we didn't do at baseline was actually measure the child development in the younger siblings. And what we found is that the kids that had grown taller after 1 year, after this additional year, they had higher child development scores across 3 of the 4 Malawi Development Assessment tool domains, and also the score in aggregate. We have a wealth of qualitative data I'm not going to talk about, but really a lot of insights that these sort of the saliency of this diversification of diet and production was really effective. And just highlighting, a couple of graphs I'm going to show you. This is just a trajectory of the younger siblings in terms of their growth. The green curve is the NEPI group, the yellow curve is the control group, and you can kind of see already, despite at baseline, no differences between the two. After 6 months, the curve starts to diverge. At 12 months, which is the trial endpoint, a substantive difference in height for age, but that difference kind of closes down after 1 year of trial implementation, so at 2 years. But what I'm showing you here is the child development results at 2 years. So we go back to those same kids at 24 months, and we see that, in green, the child development scores for the NEPI kids. These are the 6 to 24 months at baseline compared to the yellow kids, the control group kids, and the effect sizes in red. So a pretty strong evidence that this is not spurious. It's not this is actually a signal in terms of that investment that we are making in terms of their health, growth, and development was possibly a real signal. So in conclusion, despite the short time frame, we find that these preschools actually are pretty effective in terms of scaling up these agriculture nutrition interventions. And the plausibility of these impressive results is actually backed up because we found results across all these complex pathways. And the evidence pretty justifies our case in terms of using preschools as a platform to scale up this intervention. However, we find that there's also evidence that there's possibilities to improve the effectiveness, particularly if you're taking that longer-term view by making tweaks and possibly adding refreshers to try and get some of those effects that you see in year one sustained in the second year. But how do we really maximize these investments? How do we make these returns more sustainable? And this is the points that Amy will now be talking about in the next slide. Before I conclude, I'd like to thank the research partners, Save the Children, University of Malawi, and the other government of Malawi, of course, and particularly the late Professor IFPRI, who was integral in terms of ensuring that we had good quality data and made this study possible. Thank you.
Hi, everyone. I'm going to build upon what Aulo is presenting for the first 2 years of this RCT. We've been continuing to work on the NEEP project and looking at different ways to look at all the data that we have. And so one of the things that we really wanted to look into, as Aulo said, is finding out about maximizing the returns of this program. So we've been conducting an economic evaluation of this intervention. This project is actually under a separate heading. It's called Strengthening Economic Evaluation for Multi-Sectoral Strategies, or SEAMS. We're working with some great partners at the University of Washington, Carol Levin and Chris Kemp in particular, among others. So I will present the study objectives. So first, we wanted to estimate the intervention costs and look at cost efficiency. We also wanted to understand the cost effectiveness of this intervention, and then as well as the return on investment in terms of cost benefit analysis. Our methodological approach, we are developing a standard approach under the SEAMS project, so we're actually looking at a variety of different interventions to look at these different cost measures. So we already had the cost data from the NEEP trial, so we were retrofitting this data to our new standardized framework. So I'm not going to go really into detail there into the framework, but there's going to be more information and more data and results coming out of this project as time goes on. But essentially, we're retrofitting this data to the SEAMS framework. We have a series of standardized codes for our costing approach. And this included primarily integrating financial and economic costs. So we were valuing opportunity costs for government, volunteers, as well as beneficiaries, which we know is very important in this particular project because the communities are so actively contributing to the design of the program. We also had to develop allocation rules for shared costs, which in terms of multi-sectoral programs are very important because they are integrated interventions, so some of the costs apply across various program activity categories. So here, of course, we're looking at total costs, which is the total cost divided by the number of target population reached. In terms of the economic evaluation, we're looking at cost effectiveness, primarily at premature deaths, using the Lives Save tool, which was developed at Johns Hopkins University. We also looked at stunting cases averted, as well as disability-adjusted life years, so that's looking at premature mortality and morbidity due to stunting. In terms of the benefit cost analysis, we valued 3 streams: mortality, lifetime productivity, and agricultural production. Oops. And we use sensitivity analyses, adjusting different value of statistical life calculations, as well as discount rates. And here I'm going to bring us back to a slide that you've seen before, just to point out that one important component of doing the cost analysis was costing all the activities, as well as valuing the outcomes of the program. So here, this is kind of a universe of different outcomes that could be looked at in these type of very complex interventions. For the cost effectiveness analysis, these in red were highlighting the different outcomes that we were looking at. For the disability adjusted life years, they're here in blue, the different outcomes as well: death averted, stunting, and illness averted. And then with the cost benefit analysis in green, stunting, death averted, and production of nutrient rich foods. So here are first results. So this is the total cost of the program here, the bulk of which, of course, was supported by Save the Children, who is implementing the intervention. And what's really interesting to look at here is using this standardized approach, it enables us to look at the costs in several different ways. One being on the left side, breaking down by input type. So here we can see, for example, that 40% of inputs were directed toward personnel costs. So these are very interesting to look at in terms of thinking about tweaking implementation and program design. It's also very informative when we break down over here on the right-hand side by activity. We're able to see what are the cost drivers in the program. So here we have the variety of different activities in this program, including everything from materials development to training, distribution of the actual inputs or seeds for these different foods. And we can take away here, for example, that about 50% of the cost by activity were allocated to training, which makes sense because there was a lot of nutrition and agriculture training for households. And then of particular importance here is 16% of total costs by activity were actually contributed by the households themselves. So it was quite a significant community contribution, and that was both in in-kind donations of food as well as in terms of caregiving and labor. We also see down here we're able to break down by startup and recurrent costs. So about a quarter of the costs were dedicated to startup, and then the rest were recurrent. In terms of cost efficiency, we see here on the left the total cost of the program divided by the preschool children that were participating in this program. So we get about $182 per child participating in the program. And if you include all the beneficiaries that have been reached by the program, including other members of the household, that cost drops to about $40 per beneficiary, and then by household, about $200 per household. In terms of cost effectiveness, this is really nice because we can look at, for example, the number of stunting cases averted by this program. So over 300 cases of stunting were averted by the program, as well as 12 deaths. And then we're also looking at disability-adjusted life years. And here we see there are two different calculations, one using a standard life expectancy and the other with a Malawi life expectancy, so somewhere between 360 and 380. When we're looking at incremental cost effectiveness ratio estimates, so really how much would it cost to avert another case or another unit of the outcome, we see here, for example, about $569 per case of stunting averted. In the benefit cost analysis, we did basically three scenarios: a low case, a base, and a high. So these varied according to the discount rate that we used and the VSL calculation. But it's really nice to look at this because we can see in the lowest case it's about a 2.8 cost-benefit ratio up to 19 in the highest case. And putting this in a broader discussion, this is showing where our results fall in the green bar relative to other types of interventions that have done cost-benefit analyses. So we see that the NEAT program actually falls in quite high in the range, and so it's very good evidence that it's been cost-effective. So these are the results we've had so far with the costing, and we have some more information about how these results are going to be used and how they can be very effective in tweaking program design and thinking through how this can be applied to policy situations. Thank you.
Great. Hi, everyone. My name is Mary Delamonte from Results for Development, and I'll be speaking to a case study on how evidence informs decision-making, and really speaking to some of the research that has already been presented and thinking about how that's been used in Malawi and thinking about the scale or nutrition and ECD programming in Malawi. And this case study was done through the SEAMS Nutrition Initiative, which has already been mentioned. Amy spoke to some of the technical work that's coming out of that effort, the guidance and new data being generated across different multi-sectoral nutrition programs. And IFPRI's role in this partnership with the other organizations on this slide is really thinking about the policy relevance and how do we ensure the outputs being generated are really speak to the policy users and stakeholders that are using this evidence. Okay, so just to start by saying, so the government of Malawi has made nutrition and ECD a priority, and towards the end of 2018 has committed or recommitted to the scale up of nutrition actions through their ECD platform through an investment with the World Bank that are called the Investing in the Early Years. And this includes 3 components shown here. One on community-based nutrition and early stimulation interventions delivered through the care groups. These are parenting groups that Aisha mentioned. A second component on center-based early learning, nutrition, and health interventions through CBCCs, so the care, the preschool centers that was also mentioned. And then a third investment in multi-sectoral coordination capacity and system strengthening. And so what's exciting here is that the intervention, the integrated intervention that was delivered through NEEP that was found to be successful, it got a lot of buy-in from the government, and it's being integrated within this investment and really seen as kind of scaled up through this. So zooming out a little bit, there's been an evolution of research in Malawi on nutrition-sensitive actions through the ECD platform in agriculture. And a lot of foundational research that influenced the design of the NEEP program that was delivered by Save the Children. And Aisha also kind of started the conversation with touching on some of these points. So the findings from NEEP and also from research that influenced that and other research was really generated and helped support government-led discussions on what to do next, essentially, and thinking about how to advance the ECD programming in the country, which, as I mentioned, led to, towards the end of 2018, this early years investment. And so this case study that I'm speaking to, we kind of had the look at, okay, how has this research been used with the aim to understand what were the key enabling factors that informed and led to this government's decision to scale up the program, really anchored in this World Bank Investing in the Early Years program with the government. And we did this through desk review as well as consultations with stakeholders in the government of Malawi, the sectors involved in the program. And we found 4 key enabling factors that emerged. So first, having a strong base of evidence on impact and economic rationale, which we heard a little bit about already. Government leadership and multi-sectoral collaboration across all stages of the program. Strong partnerships between government and implementing partners, and then also on community engagement as a driving force. So I'll just quickly go through each of these. So first, we heard repeatedly that having a strong base of evidence generated in Malawi in the local context really helped make a compelling case for this scale up. So we heard how the NEEP program generated data on the cost and impact of the intervention, and this enabled then this information to be used to look at, what would this mean in terms of scale up, in terms of affordability, return on investment, and impact. And so what was able to be generated first, and on the cost side, the cost to deliver the nutrition actions through these CBCC centers was lower than expected, compared to kind of preconceived notions of what it might cost to deliver through this existing platform, as well as relative to other programs that were run by the government. The early years investment showed a strong return on investment from the package that was delivered, and the impact that was estimated was viewed as justifying the cost of this investment. And so a lot of this being generated based on some of the data and inputs from NEEP, but as well as other research that was done in Malawi. And it's not surprising that kind of the numbers speak to policymakers that this information get used, but this is something that we heard repeatedly, especially kind of building this economic case for investment. It really was a driving point and sticking point to policymakers on how to scale up and how to optimize. Okay, so one other note is that the NEEP program was delivered through a collaboration between 3 sectors, and this translates also to the early years investment. This includes the Ministry of Gender, who coordinate the care groups and the CBCCs, the Ministry of Agriculture, who run the Agricultural Extension Officer Network, as well as the Ministry of Health. And so the program delivered by Save the Children, it was designed as kind of a consultative process with both national level government plus local government to deliver the program, and were consulted through all stages of the design. And so in part that kind of led to a feeling of ownership over the program, but also to the results, which in a sense made the numbers kind of speak louder in that sense. The next point is on partnerships between government and local partners. So local partners in Malawi, Save the Children, delivered the ECD program, has a history of working in the thematic area and a strong sense of trust with the government. Chancellor College led some part of the data collection and really brought research in a local context. And then IFPRI, as we heard, provided technical assistance and capacity building. One of the key kind of underlying notes here, what really, there was a strong partnership and model based on that, on these partners, but what was important was translating evidence to local policymakers. So a need to kind of have this highly technical data and information and translate it in a sense of what speaks most strongly to the policymakers and the conversations that are ongoing in an opportunistic way on how to kind of push the agenda forward. The last note was on community engagement as a driving force of this program. There were mechanisms to engage with the community, get feedback, and have it kind of the program adapt in and of itself, and saw as, in terms of local government, this important aspect of the program and it being moving forward. So that was kind of a very quick run through. I'm happy to share more through the discussion. I want to say thanks to each of the presenters. They've had a hand in the case study, as well as to Save the Children, each of the sectors, government stakeholders that were involved in the development of this. And then I'll just end on a point on where we're going with this next. So as I mentioned, IFPRI's role in STEAMS is looking at the policy relevance. And through that, we're documenting examples and stories of success on how evidence has been used in nutrition programming and multi-sectoral nutrition programming, how economic evidence has been used to advance the policy and programming discussions. And so if you would like to discuss more, please contact us, or if you have stories and examples to share, please do share. Thank you.
Thanks, Mary. So that concludes the 4 panel presentations. Next, we're going to have Julie and then Natalie serve to offer some discussant ideas. Then we'll have the Q&A.
Great. Thank you, Dan, and thank you to Aulo and the team for inviting me to be part of this panel today. I think it's really exciting to see these results, and I congratulate also the presenters for their great presentations. So I think this is actually an excellent segue from Mary's presentation, because I want to dive a little bit deeper into this policy piece and how this evidence has actually been used to inform policy and programming in the case of the World Bank. So Mary briefly mentioned this investment that the World Bank has made. It was approved by the Board of Directors last December and became effective this summer. So it's a $60 million investment, which is essentially to scale up the NEP, as you saw from, or the approach that was piloted by the NEP, as you saw per Mary's slide. So, I think these types of results are really exciting for those of us who, want to see multi-sectoral nutrition programming work and who want to see this kind of evidence being brought forth. And so, as part of my commentary, I just, this may be, not what you usually hear in these seminars, but I wanted to go through the process of how this happens from a World Bank perspective. So to start off, there needs to be a letter of interest that comes from a high-level government official to make a request for financing. And so, this sounds very simple. It's an expression of interest, but it has to come from a high-level representative. This is typically the Minister of Finance. So this should trigger a thought of, okay, economic analysis. That is very critical when we're talking about a Minister of Finance. The Minister of Finance is also a person who's controlling all the budgets of every line ministry, and so who obviously is bugged probably day and night about how this program is going to be a better investment than that one, et cetera. So that's the first level of convincing that needs to be made. And this is especially difficult, I think, in the social sectors where the results are not necessarily as immediate or tangible as results you would get from investing in other sectors. But once you get that guy on board, then you can move on to the World Bank Country Management Unit. And so the letter makes it to the World Bank. And then the country management unit is yet another level of decision making. The country management unit for Malawi, for example, has a finite financing envelope that they then need to decide how they will invest. And so at this level, the decisions at that level are also going to be based on the partnership framework that exists in the country. So that's over a 5-year period. There's, okay, we're deciding to invest, in whatever health or social protection. And so that's going to dictate whether this request can be fulfilled or not. And then, of course, whether the project that's being proposed is actually aligned with, the basic goals of the World Bank to reduce poverty and to boost shared prosperity. So those are kind of 2 layers that I think are really important to mention and that dig just a little bit deeper to show how much this evidence actually matters to have in your hands and to be able to present when you are trying to scale up these types of interventions. I guess, I just really want to highlight this point of this combination of factors. You have, on one end, an enabling environment, which Mary has very systematically looked at, and I think that's really interesting. Obviously we know that that's important, but what does that actually look like? And then combine that with, a rigorous evidence and that's relevant for programmers or, for actual implementation. So the combination of those 2 factors is really what you need in order to be able to scale up these interventions to the level that we're seeing now. So kudos to the team. I think this is really exciting, and I think that, having just this kind of indicator of large-scale investment is actually a very important marker of how successful your trial has been. Now, the only other thing I wanted to raise, and this is kind of a plea that I think, it would be interesting to explore how the maternal side can be taken into account a little bit more. I think we, as a nutrition community, are very much understanding that we need to be taking mothers into account more. I think it's no surprise to any nutritionist that there's a strong link between maternal nutrition and child outcomes. In fact, Jeff Leroy makes that point about the causality in his recent paper with Ed Frangillo. And so, it's kind of a plea to the team to consider or explore how this type of platform could be used to look at how you can kind of wrap maternal nutrition into this. So I'm sure it will take some creativity, but it could be that small tweaks in the program, seeing that you've already seen some of these spillover effects, especially on the younger siblings. What are some ways that we can think about, making these small program tweaks so that we actually can go one step further and have something that's a little bit more comprehensively addressing the problem. So I will stop there. Thank you.
So thank you very much, and thank you again for inviting me, Aulo, to come here. So I'm Natalie Roschnik from Save the Children. I'm the Senior Nutrition Advisor for Save the Children UK. I'm leading on the Save UK-led nutrition portfolio. But I was, during the whole period of the NEEP project, I was the main technical advisor from Save the Children supporting this project. So I feel sort of very personally attached to it and continuously looking for opportunities to move it forward within Save the Children. So I just wanted to reflect, it was great to hear from you, Julie, on how this has been used with the World Bank. And I wanted to reflect a bit about what this means for Save the Children. I think we consider this really, I guess, the kind of success, the ideal way of doing programming and generating and using evidence. So it's kind of the gold standard, I would say. And I think from 2 things about that is, I think one, it was really came from a problem that was identified on the ground level. I mean, our field staff that were working on these ECD programs for over so many years and understand them very well, just every day could see that they could not meet their ECD objectives unless they addressed this food thing. As Aisha was saying, the preschools was closed, children would not come unless there was school, and the communities are providing the food to the schools, the preschools. And so this lack of food thing was just a problem that they had identified. And so their response on the ground was to learn to sort of take an approach that was developed in a big, huge USAID livelihood project and just transplant the sort of livelihood agriculture training on next to these preschools to address the issue. And And so, you know, everybody felt that that worked really well, but we didn't, of course, have this evidence. And then so, meanwhile, there was this another big World Bank investment protecting, a big RCT, protecting early childhood development. And Save the Children was involved in that. And they found that when they were looking for the preschools to do their baseline survey, they found that 50% of them listed on the register of the ministry were actually closed because they weren't functional. In fact, they weren't functioning. And one of the main reasons they said was because of lack of food. And so we, at the same time, had this nice sort of pot of funding from the Conrad Hilton Foundation to wrap around this project. And with that, we were able to try and understand what was happening, because we found that some communities were able to provide the food and some weren't. And in fact, there was a whole range of characteristics about the community, about leadership and coordination and so on, that meant that some could and some couldn't. And so we were able to start developing a little bit this sort of building the community capacity to provide more food, nutritious foods for the health centres. So I think what was, you know, this solution really came from the ground up. And I think it was very much recognised by the Ministry of Gender and Social Welfare, because we were working closely with them. And so I think, you know, the fact that it came up that way is also because over time it was just this recognised problem, but we didn't have the evidence. And so I think the second point is that, you know, we then worked with Aulo and IFPRI, and just this fantastic partnership, which is like the example of a partnership we always want to have. You know, and with a bit of funding from this PATH Nutrition Embedding Evaluation Program, we have to remember NEEP actually is that. We were, you know, able to generate all of this evidence that you've seen today, and actually that made all the difference, because it became, instead of being this wonderful approach that we've implemented somewhere, which we do, you know, you're going to see these programs everywhere, you know, Save the Children's in 120 countries doing brilliant things, but it's so rare that we actually have the evidence to show that it's having an impact. So this was, you know, what really made the difference, is we have all of this evidence and continuously papers coming out. It's amazing for them. So I think for us it's, you know, really kind of a unique example. It's also quite unique because it's bringing together three sectors that don't tend to work together. I mean, Save the Children is a cross-sectoral organisation, so you would think that we should be working really well across sectors, and we try to. And I say nutrition, agriculture work fairly well together, but ECD is not something that has always been so inherently an approach that works together. So I think we feel that this is a huge opportunity for us as an organisation to at least try and replicate this approach in different places. I know that this lack of food in preschools issue is not just in Malawi. It's, you know, Mozambique. We have the same problem in so many of the other countries in Africa. So we'd very much like to, you know, replicate it in other ECD programs, but also in nutrition and agriculture programs, to try and sort of use this ECD platform as a platform that actually we tend to not think of using that much. I mean, I shouldn't say using, but, you know. So one of the challenges that we face in sort of replicating is, you know, that often our funding sources are very siloed. It's sort of, we get nutrition funding, we get agriculture funding, we get ECD funding, and it's sometimes difficult to be creative and find ways of bringing these together. I think it's great that we have this, there's this World Bank funding in Malawi, but that's actually quite rare. The reason we were able to do that in Malawi was because we had this private sort of child sponsorship funding, quite a few million a year, where you can actually be creative and respond to a problem in the way you believe is the way to respond, as opposed to, so that is a real opportunity. So I think for us the next steps would really be to, you know, do a lot more dissemination with our own projects, and, you know, targeting different countries, and see also, I guess, working with the various donors and different calls that come out to see how we can integrate this approach more. Thank you very much.
So I invite the panelists and discussants to come here so we can begin the Q&A and discussion section. You all have assigned seats. Please don't forget to use the microphone. We'll start from the room, and then we'll go online in a few minutes to take some questions. So maybe I'll take a few questions at a time. You can address them to individual people on the panel, or just generally. Does anyone want to start? Okay, go ahead. Please, for the benefit of the people here and those online who may not see you, introduce yourself just before you ask your question. Thanks.
I'm Lynn Brown, and my question's directed at you, Aulo. I thought your results were really interesting in terms of the one-year impact and then the follow-on afterwards. And, you know, one of the results you almost presented negatively in saying, you know, a year later, the other people had caught up. And I wondered how much you understand of the process in the different results of that. When you say, I mean, if people have caught up, that's actually a good thing. Some of your graphs indicate that the control has improved, but the NEEPS group has gone down a little. And I wondered what the trade-offs and actual percentages are. Are your NEEPS groups still significant 12 months out?
Yeah.
Julie Kurtz from IFPRI. And just to follow that up, but I wasn't sure where the control groups were, and so what the possibility of spillover there? My question is related to, I know that the outcomes measured had to do more with childhood nutrition, looking at, I'm spacing on some of these, but the quantitative measures. But I was wondering about the role of measuring leadership, and that this you mentioned is such a ground-up initiative. And so the leadership development in these communities that has a continuous impact and informs the kind of ground level leadership that these things are possible and you can be creative and merge different programs. So is there a place for measuring that even in the economic cost instead of just measuring like what's the impact of child by cost? But what is the value of the education and leadership development on the ground, and how do we include that in a measurement?
Thank you. Let's take one more here. I can lend my mic.
Thank you. My name is Haptam. I'm from Save the Children. I'm Natalie's counterpart from US side. So it's a great work, and I appreciate all the World Bank for funding, scaling it up to a different level. One of the questions I have is, because these are young children and there is a provision of food, did you look at the food safety for these young kids?
Lucy, I want to go online before we go in the room again, and then we'll give the panelists a chance. Do we have some questions?
Yes, we do. So the first one is for Aisha from Antoine Huchi from Millennium Challenge Corporation in Benin, West Africa. What's the work that she did about saving church children? And does Save the Children, the organization, have representatives in Benin? If not, can we propose something like that in Benin? The second one is Basudev Mahapatra from India. How empowered has the community been through the intervention to apply the learnings for their own development? And the last one is Gilbert Miki, a PhD research student at the School of Agriculture, Policy and Development, who is focusing his research on homegrown school feeding in Malawi. I am most impressed by the work done. My question is to reference to the agricultural component. How is the NIPI engaging smallholder farmers in their interventions? Thank you.
Okay, that's a lot. So let's come back to the room. Maybe Aulo kick us off.
Thank you. So yeah, definitely. Thank you, Lynn. Great question. And then I'll pass the mic around to answer the other ones. No, it's a really good point. So we've just started to sort of fathom the depth of the data for the sustainability side. And there are not many previous examples we can build on. So in terms of what do we mean by sustainability and sustained effect? So I can tell you for sure that by design, because of the ethics of it, the control group received some of the treatment post 1 year, right? So we are expecting to see some catch up. And Aisha can maybe tell us more specifically about the specific activities. There are also some really nice spillovers in some ways by the communities, talking to them, because it's all in Zomba. So, it's essentially one district and 60 communities. So there is quite a lot of agroecological diversity in terms of geographical sort of distance. They are not too far. So, you'd expect some of this to happen. However, what was really interesting was that some of these results, and the way in which the results presented themselves when we looked at these sustained effects, that some of the differences that we found that were sort of substantive and statistically significant kind of made sense. So for instance, on the agriculture side, it was mostly driven by those crops that maybe took a little bit longer to harvest, like the fruits or some specific fruits that were emphasized. The results on growth kind of made sense too. The results on diets in some ways, were mostly driven by maybe the catch-up activities that were being scaled up. And also it was a much better year. So the year we ran the trial, it was a very, very tough year. And the differences that the intervention made were probably that substantive because the control group suffered a lot. So it's essentially mostly protective effects. But it'd be great, we've just started to unravel some of the data, and I think some of the answers to the next questions will sort of give you a sense of where we are in terms of sort of unpacking the community and gender dynamics of it. Amy, do you want to talk a little bit about the leadership?
Yeah. Thanks, that was a great question on the leadership. You picked up on a really important component of the program, which was that community engagement. So we weren't quantitatively measuring leadership per se, but two ways we kind of saw some of those results. One being that there was quite a lot of qualitative work done as well, and some of that work really unpacked the role of households in the program, and particularly the role of women in the program in contributing to both the school meals. There were CBCC committees. That was something we didn't really discuss that much, but that's where some of the leadership, I think, would come through as well, that they were organizing schedules in terms of trading off time invested in the program, in caregiving, in meal preparation, in caring for the school gardens as well. So that was certainly a really important part that came out in our qualitative data. Another way that we were incorporating some of those costs as well, because you mentioned, of course, this is a cost, an opportunity cost to those beneficiaries in the program. So we actually did include that in our economic costs. Any labor contributions by households were costed into this analysis. So a part of my dissertation work actually was measuring some of the time use of women who were contributing their time to the program. So luckily we were able to use some of that data and assess what those labor costs would be and those contributions and include it in the total cost analysis.
Okay, there were a bunch of questions for me, so I think I'm going to start with the easier one, which is what my role was in NIP. As I already said, I was part of the implementing team, which meant that I was coordinating, supporting, as well as managing the program activities, which essentially entailed facilitating the trainings by making sure that we engaged with identifying the trainers that we needed for these trainings. So in this case, we mainly used the Ministry of Agriculture Extension workers, as well as Chancellor College, who were providing the trainings on the nutrition aspect of it, and other NGOs that are working especially on village savings and loans, because at the time that we were working on this, Save the Children was not doing it actively. As such, we needed to kind of outsource these trainers. But also, I think the main part of my role was to engage in these communities. I think as you saw from, over the video, all the pictures that were presented, I was really in the community pretty much every single day. If it's not on monitoring the activities, it would actually be in facilitating some of these activities that I mentioned. Now to follow up on that, whether Save the Children is in Benin, I'll let Natalie answer that because I'm not very sure.
Haptamu? I don't know is the answer. We don't have big nutrition. I'm not sure ECD. But anyway, I think what I would suggest is that if you can find someone to go and travel to Malawi and go and see the approach and then come back and bring it back to Benin, something like that, because we are still implementing this within our sponsorship funded programming in Malawi. So sometimes that's the best way of transferring lessons.
Yeah, and I think to follow up on what Natalie has said, this intervention, it's easily replicated. It can, because essentially what we did use were community structures that are already existing. And I feel like in most African countries, for example, where you have farmers, like households that are doing this, it will be so easy to replicate it. So I would say go for it, and Save the Children is more than happy to actually offer technical assistance on that regard. Following up on how NIP is engaging smallholder farmers, most of the targeted beneficiaries that we used essentially are what you would call smallholder farmers. So I would say that the project all throughout did engage these smallholder farmers. And this is mainly because Malawi is a country where about 80% of households are involved in farming activities, and agriculture was a key component of this intervention. The last one on food safety for the kids, using CBCCs as a platform meant that the food contributions that were coming in, they're actually from the parents of these preschool children, as well as the community members, which meant that we're preparing their own food. And for us, what we could do was only to facilitate trainings on food safety, but because the food was coming from themselves, it was easier to make sure that the food that they were providing to these kids was actually safe and secure and good for the kids.
Thanks very much, Aisha. Before we go back to the audience, I wonder if Aulo and team could respond to two of the comments that came from Julie and Natalie in their discussion comments. So from Julie in particular, she says, "Good job, let's do more." So could this also improve maternal nutrition, and would that, is that a stretch, or could that be wrapped into what's already being done? And Natalie's question was also one that I had very much in mind, which is sort of how did NEEP really solve kind of the food thing for preschools, right? And food availability when you're relying on local agriculture. So that seems like a really critical dimension of the success in it, as what you said, Aulo, was a really hard year. So if you could comment on that too.
Sure.
Thanks.
So I'm going to pass it to Amy and Aisha to talk about women. I don't know if Julie noticed, but when she was talking, we were all having a nod. And then I'll maybe touch on the second question.
Okay. So I think that's a great point you were making about mothers and engaging them, and I think there's ample room for that in terms of within the kind of setup of the nutrition trainings. But I'm going to turn it on its head a little bit and say I'd actually like to see the men engaged more. Not to pass the buck, but I think the mothers are already contributing a lot to the program, and that was actually part of our concern in measuring their time use, is making sure that the program wasn't overburdening them because they already have so many tasks, aside from what some people think. People aren't just sitting around with nothing to do. In the countryside, they're quite busy. So one thing that we noticed was that men were definitely contributing to CBCC construction and maintenance and some participation on the committees, but I think there is probably some more room for male engagement on nutrition and on the nutrition side to help support those activities, not only just in the CBCCs, but also promoting it within the household, where they may have a role in decision making. So maybe you want to speak more.
Did you say about your time, the results that you found specifically on time?
Oh yeah, well, Aulo wants me to promote a little bit these results. So, so we actually, as part of my dissertation, I looked at women's time use specifically in the program, and looking at how female participants may have been, whether or not they were burdened by their participation. And so that was in terms of their caregiving, as well as helping out with the meals, and so on. And so what I found is we had two data points, so one after 6 months of program implementation and then after 12 months. So at 6 months, which was during the lean season, I did find a slight increase in women's time use related to the program at 6 months. It was not a large amount of time. It was about 30 minutes extra devoted to contributing to CBCC activities. But then after 12 months, there really wasn't a difference between the control and the treatment groups. So of course, any amount of extra time, you still want to make sure that that's not a burden and that women aren't being stressed by this contribution. So it was looked qualitatively as well, coming from the words of the women themselves, looking at, was this a burden to you, and what did this mean for you to contribute? And so the women basically found this to be a very worthwhile use of their time, and they said they were able to rotate responsibilities among other women in the community, so that they didn't feel like it was a great burden to them. But Aisha actually did some further work to highlight that, and she can speak about women's stress and well-being.
Thank you, Emmy, and Aulo for putting Emmy and I on the spot. I just submitted my dissertation, I think 2 weeks ago. That's actually looking at the effect of this intervention on maternal nutrition outcomes, basically looking at BMI as well as MUAC and the stress levels of these women. So I only looked at the 1 year results, that's 1 year after the impact evaluation. And even though there was no change in these main outcomes between the control groups as well as the intervention groups, I think I wouldn't consider it a now result per se, considering that with nutrition sensitive programs, there's that complexity as well. And for us, our main focus were actually the children under the study, not the women. And having seen that data, I think there is room for further research, and which is what I'm thinking through with Aulo, and hopefully work on a PhD on that. Thank you.
And Dan, so I'll take over in your second question, which is in some ways maybe under-researched from our perspective, just because we don't have an ag economist on the team, but we did try and unpack some of what was going on. So in terms of being able to provide food, so this is relative to the control, right? So these effects were mostly protective, and they were significant and substantive, but if you look at the levels at which the food was being provided, they were still pretty low. So on the intent to treat effects were about an extra maybe half day over a 5-day period. So the frequency was significant, meaningful, but still with a big margin to improve. And the fact that we didn't see any sustained effects kind of highlighted how difficult it is actually for that food to be provided. So not anecdotally, but we went through quite a few discussions with SAVE and the government on this, particularly in the lean season. We had actually an extra data point in the lean season where we actually sort of went back and looked at these same outcomes. And the lean season was just very, very difficult, and most CBCCs didn't actually provide any meals. I think sort of when we went back to N-line, it was post-harvest. So, it was really sort of resources weren't as thin. So there's really these other foods that had been planted, had been harvested. So there's definitely a little bit more availability. But in terms of how that fed into the preschool meals, that effect died out, right? So there was really, and that's, I think, a key challenge that we highlighted to the government. So there are going to be times in the year when the communities are just going to be too stressed. It's going to be too much of a burden to provide this food. So if you could provide, and we were talking with the World Food Program, for example, and other partners, to sort of tap into their activities to kind of provide that sort of collaborative framework that could really enhance the services year-round to these kids in a meaningful way. So the behavior change can only do so much, right? The information alone can only do so much. But there were plenty of information constraints that we filled, but there were economic constraints too, and there's very little that could be done around that. But we also talked to the government about providing some financial incentives to try and deal with some of these trade-offs, economic trade-offs, and that's potentially some work that we could do around scenarios using the data that Amy was presenting.
Do you want to say something?
Well, I did want to
can
I add to that? Yeah, I kind of feel there's an important point that Aulo is saying about a certain season, and this is completely anecdotal, but just visiting some of these communities, and I think it was sort of previously to NEEP, but some of the communities we visited where they were receiving food from other organizations, free food. And I remember very well one community, and they didn't have any food, and they said, yeah, we've closed the CBCCs, can't do anything because the food hasn't come. And I felt that it was having a negative, in fact, that they had received all this free food and they just, it's not our problem anymore. Whereas, when we've done this qualitative research and gone to certain communities, I mean, great example was it with you, Aulo, where we went into a visit and there was this village chief who was just loved this preschool. He thought it was the best thing, and he'd given a whole load of his own land to be the sort of preschool food production thing, and he was just the champion. And I think so I think it links up to someone's question about leadership, but I think that makes all the difference. And it's just really building the community capacity and motivation and interest is super important, rather than just freebies all the time, you know.
Great. Thanks. Yeah, let's go back for additional questions. Ali?
From IFPRI. Thank you so much for your presentations. I was just wondering about the component on parental stimulation, and I was wondering, so was it only to the mothers or also to the fathers? And if it was only to the mothers, were the fathers okay with it? Was it hard to change whatever costumes they had before, and how did you measure it? Thank you.
You had a question here, yeah? Yep.
Hi, it's Zakatia, Clements Worldwide. So a lot of these countries that are dealing and struggling with nutrition and agriculture also are struggling with clean water. And so are there any considerations agriculturally in terms of the types of crops that are being introduced and the amount of water that's being utilized in order to produce those crops?
Thanks. There was another here. Go ahead, please, and then we'll come up front. We'll reverse the order, that's fine.
All right, my name is Casey Das. I'm a professor of agricultural engineering at University of Georgia, and this year I'm a Jefferson Science Fellow at USAID. What I'd like to know is that I have not as much familiarity with Malawi, so if you would please just kind of paint a picture about the community that you worked with as to what their livelihoods are, educational level, is there chronic diseases, is there access to water, and general issues related to nutrition outside of the school program. But great work.
Thanks. There's one in the back, and then there was one. Okay, sure.
Hi, I'm Rachel Gilbert, also from IFPRI. Just going back to the issue of the particular season and the particular time, and other groups that were providing food. I'm aware that there are many disparate groups in Malawi who are providing food, especially during the lean season, especially during this time. And I'm wondering if, particularly because you had qualitative evidence and because you are working in Zomba, if you were able to account for specific other interventions that were not related to even, just like Mary's Meals, different school feeding, different smaller interventions that may have impacted these children, but particularly their siblings, as there are so many things happening at any given time in Malawi. So that's my question.
Thank you so much, everyone. Leanne King, a geospatial scientist and consultant. My question is concerning the project that you guys worked from to develop this, the U.S. Livelihood Project, just how that relates to the work that you've done and what was done here in the U.S., and then also to follow up on the volunteers and personnel, how much of the personnel was accounted for by volunteer work, and what was the costs that you found would have been, what would the costs have been if there were no volunteers?
Thank you. Okay, so let's come back here.
So I think maybe, Aisha, if you could take a few of those Malawi-specific questions. I'm dividing it up. I'm going to put you all on the spot here. I'm not going to answer. I'm just digging around.
I'll take the last one.
Yes,
Yeah.
exactly. And I'll take the question from Rachel. And Nat, can you talk about WALA, the WALA project? Yeah, no, Aisha will start.
I'll start. Okay, start with painting a picture of Malawi, especially Zomba, which happens to be a city that I've actually spent most of my life in. I did my university there for my first degree. I worked there on this new project, and my dad is actually from there, so he grew up there too, so it's home. To answer your question, in terms of access to water, I think just like most rural communities, the access to water is a problem in the sense that they have to use water from rivers, but with the coming in of NGOs that is changing, so you do have boreholes across the rural areas, especially in the community that we're working in. But also, most of these communities that we were working with, they had access to water where they could actually do irrigation, because as part of the intervention, they were required to grow crops twice a year for winter cropping, which does require access to water. So the CBCCs specifically did have that. It might not be the case for all the households, but the CBCCs did. In terms of illiteracy levels, they're very high, and that is why for us, I think working with these communities, it was best to use extension workers that were already placed in the communities because they already have a rapport with the communities, which makes it easier to engage with them. So the trainings that we were using, they were more in tweaking them to actually make sure that for an illiterate community, it could be easy for them to grasp. Chronic diseases, Malawi, as you all know, it's got high levels of HIV and AIDS, and CBCCs actually started with providing that environment for children that were orphaned from parents that died of HIV and AIDS. So that was the context of how CBCCs started. Of course, that has changed, but I think that does paint the picture. And nutrition as well. We have one of the highest rates of stunting for children. I think as of last year, 2016-2017 DHS data, stunting was at 37%. Yeah, I hope that answers your question. Okay. I think I'll pass it on to Amy before I continue.
Okay, in terms of the volunteer time, I hope I'm covering all of this, but I think that's a great question in terms of thinking about what this would look like without this volunteer contribution. As I presented earlier, it was about 16% of total costs, I think 25K roughly. And we're also continuing to update this cost analysis. We are looking at different ways of valuing volunteer time, so looking at kind of upper and lower bounds in terms of whether we're using a minimum wage from Malawi and which version we're using. So we're going to be doing different sorts of kind of modeling and scenario building as part of our contribution to this policy process, collaborating with the World Bank and with IFPRI as well, and with government, of course. So that, yeah, that was really a critical part and something we're going to think through with them as they look forward to how it's going to be scaled up.
Maybe I'm just going to talk quickly to Rachel's question and then pass it over to Aisha and Natalie to argue about who's going to talk about Aulo. No, Rachel, thank you very much. And it's a plug also to thank the Malawi office of IFPRI, because, you know, we had phenomenal support from you, from Bob Balch and the whole team. And I think I can't really underestimate the effect of having an IFPRI office there to allow for that whole policy dialogue that we were having. It was really fantastic. And particularly Nora Aberman, you know, and the contributions she made were really fantastic in terms of being able to corral and bring everybody together to discuss these across sectors. So, as you know, the first thing that struck me in Malawi was, you know, when I got to Zomba, you know, you drive around or you walk around and there's a white Jeep with a different logo from every single NGO, every single organization you think about. It's going to be there in Zomba. It's going to be there in Malawi. It's shocking. I didn't realize the extent of it. So it was something that was really apparent that we had to right away, right from the start, get a handle on this, because you're not going to be working in isolation. So, you know, we had a lot of questionnaire time, actually, just to figure out exactly what else was going on, you know, and try and sort of make sure we're capturing all of that and making sure it's all balanced at baseline. You know, hopefully the randomized sort of design takes care of that. So that's the easy answer to a difficult question that we always have to face. And I think, you know, it would be really great to try and see if there's particular synergies between other activities and other programs like, you know, Mary's Meals, who are sort of, you know, targeting that sort of meal component, or the WFP is targeting that meal component, and how we can work in synergy, right? Rather than providing a disincentive, right, by providing some of these fortified blends at a specific period of time, use it as a way to, you know, maintain these positive sort of spirals that the communities are doing, rather than acting as a break.
I think...
Aisha, we have time for just one more minute of follow-up, and then we're going to go to closing remarks. So you get the last word before that. Okay, thanks.
But I wanted to answer the question on the crops that we used. We had a lot of consultation with the Minister of Agriculture, considering that they knew the ecological zones of Zomba better than we did. So most of the crops that were used were actually informed by them, but also considering that this was a behavior change intervention, the one thing that we didn't want was to introduce something that we thought would be alien to the community. So for example, Malawians normally grow crops, and like maize, for example. We thought it was best to bring in the orange maize, which really is just something that is biofortified, not really different from what they normally used. But also an example on the vegetables, we wanted spinach because we actually thought that it had a very good nutritious value, but because the communities were not used to that, we had to change that to amaranthus. So I think that answers your question. Yeah.
Thank you. I want to thank everyone and give Harold actually gets the very last word.
I have to thank everyone for what has been a fascinating session. I mean, apparently there are people at the window clamoring to hear more, and no mean feat because we're at the 12th floor. So it's very, very interesting. Now, we heard from the very beginning in Dan's introduction, we've heard many times the word platform mentioned. And that, I think that's very important. Years ago, decades ago, people were talking about integrated nutrition planning. Recognizing the model about how many different underlying causes there are to malnutrition. But in practice, that wasn't working very well. So people started to think, well, plan multi-sectorial, but act sectorial. And even that had its problems because of the incentive structure of acting sectorial. When you get down to a platform which is community, and you're thinking globally and acting locally, and that sets up an automatic multi-sectorial potential. And one thing you find, nothing succeeds like success. When you've got the community working together, then you see other ways of working together. You get the motivation, and that's what you're seeing there. You mentioned you've got some side things. Somebody asked in the audience, well, how's that going to affect other things that you didn't yet mention, including depression, including stress levels, and having the community together and seeing that it can do something together sets up your social capital, sets up a potential for doing more. As far as where you can go in the future, because one ends a bit with going forward, think about it both on the extensive margin and the intensive margin. And looking at it from the extensive margin, there are some issues that you're going to have to think. I'm very pleased, having spent 20 years at the World Bank, to see the speed on which information went into project design. It doesn't always happen that way. And it'd be great if you document that and share it more widely. But you still have a challenge. With all due respect, Julie, to your managerial capacities, you're not going to have a cadre of Aishas in the villages. And so how does one change this model when you go over to a nationwide model, which becomes top-down by its very nature? You don't put $60 million into Malawi from the ground up, it comes from the top. And you're going to have to consider how to get that social capital, how to get that community event, which is, I think, central to what we're seeing here as you go to scale. And what's it going to mean to costs? What's it going to mean to outcomes? There are a lot of questions that are going to have to be addressed. At the intensive margin is a very different issue. We see, and I don't know Again, there's a fair question was asked about the convergence. Is that a good thing or a bad thing? If it's regression to the mean, it's neutral, but it does mean that our outcome in nutrition, in stunting, is still a transitory outcome. The outcome that we want for the long run, and this must go into your model, Amy, I trust, in your long-term model. Obviously, the life saves, that's very permanent. But as far as the productivity, it comes through the cognitive development. And the cognitive development results seem to be quite extensive, quite impressive. Now, the question is this going to be also, is it going to fade out? Because so much in the early childhood development literature is showing fade out. Now, I actually argue it's not fade out, it's eclipse. It comes back a few years later, and there's evidence for that. But there is a question on how that works and how it integrates with other preschool and school level programs. I mean, and there goes a bit to the issue of sustaining school feeding, because most economists, most people, education specialists say the rates of return to education are particularly high for preschool, and they decline, although they're still high, as you go on. But school feeding programs are almost never in preschool, partly for funding issues, partly management issues, partly because they're out of the Ministry of Education often. If they're in the community, as Natalie pointed out, they may be very sustainable. But then what happens next? Where do they go from the time they are 2 to the time they are 5 or 6? Can you get that long-term integration as part of your intensive margin to build on these promising early childhood results? So I'm going to take the liberty, even though it's not my role, to invite you to come back in a year and in 3 years to see how this takes forward from a very promising result. So thank you all.
Harold, thanks a lot, and thanks to Aulo and the entire team and everyone for taking time to come today, those of you in the audience and those online. Really appreciate it. Enjoy the rest of your day. Thanks.